folks, I hope you're well. And today we're quickly going through the ADRs of Ramipril. So this is a very crucial video to make. So a very important point when it comes to Ramipril is the monitoring points. So if in a Gphc exam they were to ask us, what would you monitor with Ramipril? The main things you would monitor is renal function and serum electrolytes, right? So the reason why you would monitor renal function before initiation is mainly because it can cause renal impairment. And as we know, Ramipril in short term is nephrotoxic. Long term, it is nephroprotective. So as you can see here, one of the ADRs of Ramipril is renal impairment. So the NICE guidelines saying check renal function and electrolytes before initiation and 1 to 2 weeks after starting, after each titration of dose, and regularly throughout treatment. So they haven't really specified the interval, so what regularly throughout treatment it means, but anyway, just remember you check renal function and serum electrolytes, and you check the potassium levels because of the hyperkalemic effect. Now, why does Ramipril cause hyperkalemia? So Ramipril can cause hyperkalemia because it inhibits ACE, angiotensin converting enzyme, which reduces angiotensin 2, which reduces aldosterone, and aldosterone is responsible for potassium excretion. So because aldosterone is responsible for potassium excretion, you lower the aldosterone level, hence keeping more potassium in the body, leading to hyperkalemia. And that's why before initiation of Ramipril, you must monitor serum electrolytes. And that includes 1 to 2 weeks after starting an asymptom after each increase in dose and regularly throughout treatment. So let me just clarify this. The monitoring of serum electrolytes here, it says monitor serum electrolytes 1 to 2 weeks after starting asymptom. However, here it says check renal function electrolytes before starting. So I would interpret that as before initiation, you would monitor serum electrolytes and renal function, and 1 to 2 weeks after starting asymptom and after each increase in dose and regularly throughout treatment, as it says here. So if you have a cough, especially if the cough is reducing the adherence or affecting the patient's quality of life, then you would switch them on to losartan, as it says here. Consider switching to an ARB. If you have angioedema, which is a non-allergic drug reaction, which can precipitate angioedema, you would stop asymptoms immediately. So it's a bit similar to elevation of hepatic enzymes. So with Ramipril, any elevation of hepatic enzymes or jaundice, you would stop treatment. However, it's important to note that this is a very rare ADR, and that's a very crucial point to understand. It's not common, right? So the common ADRs from Ramipril and other ACE inhibitors are here: dyspepsia, dyspnea, muscle spasms, vomiting, rash, dry mouth, arrhythmias, which is a bit interesting to look at. So yeah, so anyway, so angioedema would be preferably CCB. So if you have hypertension, because bear in mind that ACE inhibitors can cause hypotension. So if hypertension is symptomatic, then you would consider reducing the dose of ACE inhibitor or halting it. So I don't believe the Gphc will ask this, but this is just something to note. And we've already discussed if someone has any elevation of hepatic enzymes, whether it's CK, ALT or AST, or jaundice occurs, you would stop treatment. And as you see, there are some interactions here like diuretics. So Ramipril can cause hyperkalemia, spironolactone or eplerenone can cause hyperkalemia as well. Obviously, allopurinol, increased risk of hypersensitivity and leukopenia. NSAIDs, as obviously ibuprofen can cause a small amount of hyperkalemia. Digoxin is important as well, as obviously Ramipril can cause hyperkalemia, which may alter potassium levels and affect digoxin. So cyclosporin can also cause hyperkalemia. Heparin can cause hyperkalemia as well. And as we said, NSAIDs can increase the risk of deteriorating renal function. deteriorating renal function, hyperkalemia. Now, before I finish the video, a common EMQ or a common pair that's asked about in a GPC exam is lithium and NSAIDs, or lithium and Ramipril, or NSAIDs and Ramipril. These are three pairs where the GPC exam loves to ask about. And thank you so much.